Hi, I'm Dr. JJ Wicker.
And I'm Dr. Lindsey and today we're going to be talking about
multiple disabilities and its implications for hearing, how to test it, how to treat it, if you should treat it, all of that
all
kind of
the
stuff.
things. All the things. But before we talk about that, if you haven't already, please like and subscribe to our channel and push the little bell at the bottom
To be notified
of our new content. Thank
Yep.
you for helping me through that little dip in ability to talk.
The new lingo. So this is a topic that I'm really passionate about. And it's because it's kind of where my research lands.
Yeah.
I of course have my clinical doctorate in audiology, but I also have a PhD in disability disciplines. And so while clinically, I'm trained as an audiologist, a lot of, philosophically, the things that I can think about are these implications for when a child, beyond having differences in peripheral hearing acuity, what other differences exist and what roles do those play in how we approach audiologic intervention.
Yeah.
And I care about it because I think that there's not discrimination, I don't think that's the right word, but I think that there's this perception that if a child has multiple disabilities, then you kind of do less audiologically. Mm-hmm. I've seen it, at least. I don't think it's like a huge epidemic of a problem. But.
Right, I do think, and when I've seen this the most, especially working with newborns, is a lot of times as a newborn or as a young child, some of these disorders or differences can be life-threatening,
right.
Whereas hearing loss isn't life-threatening while it's still important. So a lot of times the focus will go towards, rightly so, these life-threatening things, and hearing loss kind of gets pushed to
like a back burner.
Yeah. And really what we're trying to say is not that that's inappropriate, because of course, helping what's most important first is absolutely what you should do. But then there's a point in time when you need to bring that hearing loss and really bring it forward.
And the reason being is obviously, yes, we want these beautiful children to live. So I agree somewhat with that idea that hearing gets put to the side while these life-threatening things are treated. But what I think where I get concerned is where the messaging goes with that, because a lot of times you do end up working with these parents where hearing might have been very important to them from the offset as well, but they're the ones being told, don't worry about it, and so then it happens that a year down the road, the parents are finally feeling like they're okay to address it.
We've lost all that time.
We've lost that gap of time, and also just the messaging of hearing isn't important, which isn't what we're saying. We're just saying that right now we need to keep your child on oxygen, and we need to keep them incubated. Those are the kinds of things. We don't want people touching them right now. We don't want things on their ears. We don't want to agitate them, and that can sometimes be translated, or I guess communicated as hearing doesn't matter. And that's where I think it becomes an issue. And in one of the studies that I did do, I looked specifically at parent perceptions for how they decided to prioritize hearing when they had children with Down syndrome specifically. And I chose that population because children with Down syndrome, about 70% will have hearing loss at some point. And it can fluctuate. A lot of times it's about their middle ear stuff, blah, blah, blah.
But always.
But sometimes it is permanent, and sometimes it is something that needs intervention. And every single one of those parents, one of their values was, we want our child to communicate. And I feel like that's where my kind of passion for this comes in, is because that goal, that value for their child is 100% of the time there. But then you hear these stories about, but we didn't have their hearing first tested until they were 5, even though they failed their newborn hearing screen. And it's because they had things like open heart surgeries.
Right, so many things.
Yeah, they couldn't feed for the longest time. They were in the NICU for the longest time. And, I'll never forget one of the interviews I did. A parent said, their reasoning for not managing hearing-related needs was because they were just so sick of doctors. By the time they got past that newborn stage, they were like, we know he referred on his newborn hearing screen. but I don't want to go.
Yeah, and I think parent burnout is a real thing, and
Huge.
especially if you've got multiple different things going on. A lot of times it isn't. Their parents can be very burnt out, and understandably so. It can be very. First of all, you're getting devastating news sometimes, or a lot of times, and you're not ready to take that next step to the next thing. But also while recognizing that, also recognizing the importance of tackling these things as soon as possible to have better outcomes.
Right. And so that's where I feel like we can come in, because I don't think we need to necessarily be pushy about like, nope, he referred on his newborn hearing screen, let's get that test, let's get those hearing aids. Like I don't feel like we need to be that, but I do feel like we need to check in, and we need to not make assumptions that parents aren't ready. You know, I think that's a big thing, and is one of those things that, you know, I hear a lot, especially among children with cancer. And I was kind of working on a study looking at that, where there's this huge assumption out there that if a child has hearing loss induced by cancer medications, that we don't need to do anything about it, or we shouldn't do anything about it because we just assume that families are overwhelmed. And that could be 100% true, but we don't know that unless we empower parents.
Yeah.
Right, yeah, we need to empower the families.
Yeah, and I think sometimes, so for those of you who might be watching this that don't know, a lot of the medications that they use for cancer treatments can cause hearing loss, and we see that quite often. It can cause tinnitus, and also the child, sometimes they're worried about overtaxing the child, and sometimes it is to overtaxing the child to fit a hearing aid if they need it, but sometimes the child needs it and wants it. And this happened to me on several occasions working at a children's hospital, where I had a child who did get hearing loss from his cancer, and he cried when we ended up getting him fit with hearing aids as an inpatient in the hospital, because then he could connect to his iPhone and his iPad and also hear the conversations of what was going on around him. So even though he was very, very sick, it was very important to him, and we didn't realize how much of a benefit it was until we got it, and mom and dad and him and I, cried. It was a beautiful moment. But I think you're right, not making assumption that something is too much, while also, kind of walking that fine line of not pushing,
not being too pushy. Yeah, right. Well, and I love, maybe to wrap this up, you have a story that is just, I think, way too touching. About working with a kiddo who was terminal. Go ahead and share that.
Okay, this is a very tender part of my career, something that I really pushed for. So I had a mom approach me whose child was terminal, who was an infant. So from birth, they knew that the lifespan was likely not going to be very long. But we also knew that he had a moderate to severe hearing loss, which is a very fittable with hearing aids type of hearing loss. But the child had very small ear canals. And the mom came to me after we had already received testing, so we knew what the hearing acuity was. And she said, I just want my child to hear my voice before he goes. Sorry, it's very tender. And I said, then we are going to make sure that your child is able to hear his mom's voice before he passes away. And I got a lot of pushback from the ENT, who needed to, with children, you need medical clearance before you can fit a hearing aid. And the ENT said his ear canals are too small for a hearing aid, and I said, I've done impressions of the ear. I think it can be done. And so he reluctantly signed a clearance for hearing aids. And then when I sent the ear molds off to the company who makes ear molds, they called me and they said his ear canals are too small. And I said, I don't care, make the ear molds. We are going to do everything that we can so that this child can hear his mom's voice. And they were able to make the ear molds just fine. We got the ear molds, and they were teeny tiny, but that baby was able to hear his mom's voice before he passed on, and that's why I do what I do. And sometimes you push and you push to be able to get these kids what they need and also what the parents need. for the outcome they're looking for.
Yeah, regardless of the barriers, sometimes
Yeah.
you just got to push past them, and I think that's again why it's so important to work, because the value was from the mom. Like,
Yeah.
we knew that the outcome for the child was poor. We knew that he wasn't going to have hearing aids for very long at all, but the mom, that's what the mom wanted, and that's what she needed,
and we got it.
And we got it,
And sometimes you do have to fight for the things that as a parent, you get these gut feelings, or you're the parent, and it's okay to fight and for what you want and what you feel is best for your child. And you may have an ENT or an audiologist that's telling you one thing, and you may have to say, I disagree. This is why let's push for this. Let's go for this. And I'm absolutely, as an audiologist, I'm great with parents who disagree with me and tell me why, and then I say, okay, well, let's switch gears, let's pivot, and let's go towards that. And I feel like that's extremely important in working with children, and especially children with multiple things going on, because there are so many things that we're trying to work on at the same time.
So if you have a child who has multiple disabilities and has hearing related concerns on top of that, feel free to comment, share your experiences. We'd love to hear from you, and we'd love to know your insight. And otherwise, please like and share our content, and subscribe to our channel, and click that notification bell so that as we come out with further content, you can share with everyone in the world.
Bye, everyone.
See ya.